I just wanted to talk on the country Thailand, just because it is one of the top two to have low numbers in positive COVID cases. Um, they have at least 3,389 confirmed cases compared to the US, where we have 5.63 million cases. They have a 95% recovery rate with 58 deaths overall, well, compared to the US, where we have 175,000 deaths. They are at a level 1 low risk, so they are not as, I would say, closed as how the US is. As of late July, they have had no new cases for at least 2 months, which really shows how they're trying to contain this new virus, but their economy has been affected greatly. 65% of individuals had expressed that their income has been inadequate, or that they have been adversely affected. With that, there has been government support and loans, and cash handouts to support the Thai community. With that, the young population, which totals at least 500,000, are at that age where they're joining the workforce, and they're being affected greatly because there's not a lot of jobs in the country, so they won't be able to, will get a job typically, with being, half or most of the world is under unemployment. One form that I've seen that Thailand has focused is having the principle of leaving no one behind, while having to invest in forward-looking policies. So one way that they have shown is that they've been strengthening their surveillance and having laboratory capacity, so they can have faster results, and having, individuals quarantine or isolate, whatever the situation may be, compared to the US, where we're waiting maybe possibly a week, maybe 2 weeks even, to have our results. And even then, sometimes the individual doesn't get the right information sent to them, or exactly what to do once they find out that they're positive, or even negative, or someone they know that has been tested positive. Their labs in the US have been greatly impacted, meaning, like, I know with the systems that some counties are using, like how already maybe labs have been withheld for like maybe 5 days, which really impacts like how Americans are, how are they getting their information, or how to, properly quarantine or isolate, or how to, what to wear, or what mask to wear, or what precautions they should be taking. They have also found or had joined private and public sectors on getting vaccine research. As of September, they're looking to gain access with Oxford's vaccine research team to have a vaccine accessible. They have also used telemedicine, such as like how the US is using too, to reduce the numbers of individuals going to clinics and hospitals in Thailand. Migrants and refugees actually have been getting help as well. They've been getting proper PPE and having health services being accessible to them as well. Their principle has been really focused on having a social protection, so they've been monitoring gender-based violence and violence against children, while strengthening their prevention and response time. And in one way that they've also been showing like community efforts is that like more than one third of their community members have donated resources such as food, cash, and supplies to help those who really need it. And even in some regions, there's been more donations. And it really just shows how together they are in battling this virus or this pandemic. Whereas in the US, it's kind of like separated, where you fall into your state, and then, you know, a lot of mixed information is being released, where, you know, one state is doing this, one state is not doing that. So it's really like Thailand is really showing how united they are. And I really admire how they're I guess battling this grand issue that we have as of now. And that's just a little of what I wanted to share.